Imagine waking up with a fever, headache, and body pain. At first, you think it's probably just a normal infection or seasonal illness, but over the next few days, your condition becomes worse. People around you start getting sick too. Hospitals begin filling up, healthcare workers rush into action, and suddenly local concern becomes a global discussion. This is how infectious disease outbreaks can sometimes begin. And one of the most feared diseases that has repeatedly raised concern across the world is Ebola. Ebola is not just a name we hear in the news. Behind every outbreak are real people, real families, and healthcare workers risking their own lives to save others. Hello everyone, welcome to MedPharma Global, your source for healthcare updates, pharmaceutical news, clinical research insights, and medical education. If you enjoy learning about important healthcare topics, subscribe and stay connected. Now let's understand Ebola in a simple way. Ebola virus disease, commonly called Ebola, is a severe and potentially life-threatening illness caused by a group of viruses known as Ebola viruses. The disease was first identified in 1976 near the Ebola River in what is now the Democratic Republic of Congo. That is where the virus got its name. Since then, multiple outbreaks have occurred, mainly in African countries. Scientists believe that fruit bats may be the natural carriers of the virus. Sometimes the virus can spread from infected animals to humans and then continue spreading among people. One important thing to understand is that Ebola is not like a common cold or seasonal flu. Many people mistakenly believe it spreads easily through the air, but that is generally not how Ebola transmission occurs. The virus primarily spreads through direct contact with infected body fluids. These body fluids can include blood, saliva, sweat, vomit, urine, and other secretions. A person can also become infected by touching contaminated objects or surfaces. This is one reason why healthcare workers and family members caring for infected patients are often at higher risk. During outbreaks, protective clothing, gloves, masks, and strict hygiene measures become extremely important. Now let's talk about symptoms. One challenge with Ebola is that its early symptoms can look very similar to many common illnesses. Initially, an infected person may experience fever, weakness, fatigue, muscle pain, headache, and sore throat. At this stage, someone may think they simply have a routine viral infection. But as the disease progresses, symptoms can become more serious. Patients may develop severe vomiting, diarrhea, stomach pain, skin rash, and in severe cases, bleeding complications. Many people immediately associate Ebola with severe bleeding, but not every patient develops dramatic bleeding symptoms. The virus can affect multiple organs and systems throughout the body, making it extremely dangerous if not treated quickly. So, why does Ebola create such global concern? The answer is because some outbreaks have shown high fatality rates, especially when healthcare resources are limited. The disease can spread within communities and place enormous pressure on healthcare systems. One of the largest Ebola outbreaks in history occurred in West Africa between 2014 and 2016. Thousands of people lost their lives, and the outbreak captured worldwide attention. It reminded the world how quickly infectious diseases can affect communities and why global cooperation is essential. But there is encouraging news as well. Over the years, science and medicine have made significant progress in understanding Ebola. While there is no instant cure, supportive medical treatment can greatly improve outcomes. Doctors may provide fluids, oxygen support, blood pressure management, and treatment for secondary infections. Scientists have also developed vaccines that have shown strong effectiveness in controlling Ebola outbreaks. This has become a major advancement in public health efforts. Whenever health authorities detect new Ebola cases, rapid action becomes critical. Teams immediately begin identifying infected individuals, tracing contacts, isolating patients, educating communities, and implementing vaccination strategies. The goal is simple: stop transmission before it expands further. Ebola reminds us that infectious diseases remain a challenge for global health. But it also reminds us of the power of science, healthcare workers, and international collaboration in protecting lives. If you found this video useful, subscribe to MedPharma Global and follow us on LinkedIn for more healthcare and pharmaceutical updates.